That Kenneth mentioned healthy SG.
Yes.
I thought maybe for our audience we could just
Briefly talk about it.
What for specialists. I also not too sure what healthy SG is all about.
Yeah.
Sure. I mean, I can share with you a bit about Healthier SG.
Yeah.
So Healthier SG is a really complex scheme. There are many limbs to it. The first one is actually preventive health. So it actually funded a first check-in with our GPs, and that allowed us to promote health screening, for example, for patients who have not received their health screening. Secondly, also their vaccinations. And so there was a large uptake in terms of influenza vaccinations, pneumococcal vaccinations among our older patients.
Is there age criteria for health screening and vaccination?
Yes. So there are certain criteria for age, certain criteria for example, vaccinations, their medical conditions, or whether they have also hit a certain age.
And it's for citizens and PR.
It's for citizens and PR, although citizens receive more subsidies than PRs. Yeah.
And it's for, currently the rolled out is for those who are above 40 years old. Yeah. Are you 40 already?
What do you think?
Have you enrolled with a GP?
Not yet.
Eventually.
Okay, sure. Yeah. Difficult choice, but I'll choose one. And so you mentioned about vaccination screening. What's the other limb?
Yeah. So and that's not the end of it. For the preventive part, we are also doing things like risk factors. So analyzing your height, your weight, your BMI, to tell them whether they are overweight or obese, promoting exercise and diet, as well as smoking cessation. So those are all in the preventive component. The second part of it is also the chronic care, right? So under Healthier SG, we are able to order subsidized medications from this company called ELTS.
Yep.
So the amount that we charge our patients will be capped at a cap price from MOH. And then when we purchase the medicine, let's say to stock, it will be also at a price that MOH has set. And so in that sense, patients are assured that the amount that they are paying is comparable to that at the polyclinic for their medications.
So what you're saying is, as a private GP, you own your own clinic and business. You have to get the medications from ALPS and sell it to the patient at a fixed price. So you can only get a fixed profit.
Correct. The margin is
But
fixed.
of course, that benefits the patient. But does the government give you any subvention of subsidies to do this to benefit the patient?
No, unfortunately, we don't. The patient benefits because through this scheme, they are getting, like what you said, a fixed price. Secondly, of course, the government also subsidizes based on their income, whether they are CHAS Blue, CHAS Orange, CHAS Green, PG or MG, they are getting a fixed percentage of their medication bill. Right. So that helps, especially if you are taking multiple medications.
So, Kenneth said it is not no subvention to offset. It's not exactly no, but there's an amount called CEG, the chronic enrollment grant.
Grant.
And this amount is, I can't remember the actual amount, but it's an amount based on the number of chronic patients that's on your list in your clinic. Yeah. So most GP find that this amount is still very small compared to what they could have lost. So that's why there's a lot of negotiation between the GP sector and MOH. We're trying to refine the scheme. So a lot of it is work in progress. Yeah. So whether you will get it such that you reach the same level as, say, a private patient, then we are really not sure, because a lot of things are still very fluid. Yeah. But at least we are in the talk.